Coming up on 101 West, hospitals are facing an incredible strain financially, from rising costs for medicine to labor to less money received for the care of the elderly and those disabled. Hospitals are closing, including locally. How did we get here, and what is being done to fill the void? The Emmy-winning 101 West starts right now.
Good evening, I'm Derek Steyer. If you've seen any of our past 101 West news programs, you know our program originates from our 101 West Boardman studios. But tonight, we come to you from Youngstown's North Side on Gypsy Lane, the former site of Northside Hospital and Todd Children's Hospital. For many, this area has become unrecognizable. What used to be a well-manicured healthcare complex has been overtaken by weeds and overgrown grass. Northside closed 7 years ago after 89 years of service, and it's predicted another 700 hospitals across the U.S. are at risk of closing in the near future. Why? In tonight's program, we'll look at some of the factors affecting the quality of health care, and we'll detail local efforts being made to provide the quality of care that our valley deserves. But first, an overview of what many are calling a badly broken and dysfunctional healthcare system.
People are very sad and disappointed today that Northside is closing on September 20th.
It was back on August 15th of 2018 that the nurses and staff were informed that Northside Medical Center would be closing. Management said not enough patients were choosing Northside, that utilization had dropped 70% in the last decade, and on any given day, 4 out of 5 beds were empty. Northside's demise was not an anomaly. In the past 15 years in Ohio, 21 hospitals have closed, including the most recent, Trumbull Regional Medical Center and Hillside Rehabilitation in Warren. In November of 2024, Becker's Hospital Review detailed hospitals across the country at risk of closure. Ohio has 5 hospitals at risk, with 2 at immediate risk of closing in the next 2 to 3 years. In PA, it's predicted 13 hospitals are at risk of closing, with 7 at immediate risk of closing in the next 2 to 3 years.
Many hospital systems, not only in Northeast Ohio, but in Ohio in general and across the nation, are financially struggling. And so I think the question is really, what are we going to see 5 years from now in the healthcare landscape?
And the numbers back up that financial strain. Last year, 51% of Ohio hospitals reported either breaking even or losing money. 72% of rural hospitals broke even or lost money. We take that one step further and look at Ohio hospitals operating with a 2% or less operating margin. The numbers jump to 67% for Ohio hospitals, 88% for rural hospitals.
If you look at the general economics of hospitals and health systems, we see expenses, healthcare expenses, rise faster than household inflation, technology, pharmaceuticals, et cetera. Layered on top of that are the workforce challenges that have led to fairly significant labor inflation. And on the revenue side, about 70%, give or take, depending on the hospital, of our patients come with government payers, principally Medicare and Medicaid. And those are critical resources for our patients and for our healthcare system. But that revenue, that reimbursement has also not kept up with inflation. So healthcare is getting squeezed on both ends.
So how did we get to this point? Why can't the Mahoning Valley, and for that matter, the nation, sustain a healthy healthcare system? I'm Caitlin McCarthy, and I'm looking for the answers to that question. Some of the answers I'm getting are obvious. Higher costs and fewer workers. Then you have less help from the federal government and private owners squeezing the profits from hospitals. No matter the reason, the strain on our local healthcare system is real.
In what the hospital is calling a staff adjustment, 77 full-time workers will be laid off.
Stewart Healthcare has put all of its hospitals up for sale, including Sharon, Trumbull, and Hillside Rehabilitation in the Mahoning Valley. Some buyers.
Hundreds of medical professionals are waiting in limbo following Thursday's announcement that Insight Trumbull's emergency room is now closed. As transfers continue for all
We've seen the struggles Valley hospitals have been facing recently, but it's been a struggle for decades. You may remember the closing of Southside Hospital, Woodside Hospital, Todd Children's, and Youngstown Osteopathic, to name a few. But why do hospitals fail? The first is cost. Like any business, healthcare systems need money to stay open. So as prices rise, so do the pressures. The American Hospital Association says the cost of labor, treating chronic conditions, and hospital equipment are all continuing to grow faster than inflation. Adding to the cost, people are getting sicker and more are inclined to see a doctor. Chronic diseases, for example, are becoming more prevalent in the U.S.
When you think about kidney disease, cancer, cardiovascular disease, asthma, these are pretty serious, and when you think about 15% have 3 or more of those, that is concerning, which puts a lot more need and demand on the healthcare system.
Between 2010 and 2019, emergency department visits related to heart failure increased 127%. The spending to treat those patients went up by 177%. Chronic diseases like acute renal failure and type 2 diabetes are also rising, both by double digits. During COVID, people who were sick waited to get care. So by the time they went to the doctor's office, they needed more advanced treatment. And a sicker patient costs more for both the hospital and the patient.
They weren't going to the doctor for that normal preventive or primary care services that they were used to. And so in the wake of COVID, time and time again, I hear from facilities that they're seeing, again, patients that are sicker, more complex because their care went untreated for several years.
Then there's the cost of drugs. Drugs cost hospitals $144 billion in 2024. But you may be asking, but they bill me for those medications. So how can they be losing money on them? Which brings us to reason number 2, Medicare and Medicaid reimbursements. Hospitals are losing money on reimbursements. Medicare and Medicaid reimbursements are lagging behind inflation. And this is especially stressful on rural healthcare facilities. The National Association of Rural Health Clinics advocates for rural health care across the country. One of their biggest concerns, the cuts to Medicaid. The group advocated against the $1 trillion cuts to Medicaid laid out in the Big Beautiful Bill. As a result of these cuts, the Congressional Budget Office estimates 10 million people will be at risk of losing their insurance in the next decade, including more than 162,000 in the Valley. KFF is the leading health policy organization in the U.S.
Most people are eligible for Medicaid because of their low income. And so I think definitely if you're in an area where people are, around the federal poverty level, I think that means there's a lot of folks that could be impacted by these cuts.
And these cuts could be felt pretty deep here, where all 3 counties have a higher poverty rate than the state and country.
As more of those folks lose access to healthcare through their insurance coverage, that doesn't mean that they stop showing up to the doctor's office or to their local emergency department. It just means that those facilities don't receive payment to care for those individuals.
The Big Beautiful Bill does put $50 billion aside for the Rural Health Transformation Program. This program is designed to offset the cuts to Medicaid. It's a $50 billion 5-year initiative to help sustain rural health care. States get the money and can decide how to best spend it.
The way that this fund is designed, there's a lot of unanswered questions to start, and it's certainly not a one-to-one in terms of making up the difference between what the estimated losses are going to be from a coverage and therefore revenue perspective.
Medicaid spending in rural areas is estimated to decline by $155 billion within a decade.
This is a particularly large cut, the largest we've seen. And so there's a lot of concerns about whether they'll be able to keep their doors open.
Those cuts are leaving some U.S. senators worried about the future of hundreds of hospitals. Hospitals like East Liverpool, one of 11 rural hospitals in Ohio, cited as being at risk in a North Carolina study. The impact of these cuts go beyond rural health care. The KFF says the cuts affect every hospital that treats Medicaid enrollees.
Medicaid accounts for about 1/5 of all healthcare spending. So it's a major payer in the health system, and $1 trillion sort of in cuts from the program over 10 years could have an impact on sort of how everybody accesses care.
Then there's Medicare, the senior citizen health care insurance. In Ohio, 22% are enrolled in Medicare. In the past 5 years, more senior citizens on Medicare are opting for more coverage and selecting supplements like Medicare Advantage. The difference between the two, traditional Medicare is administered by the government, and hospitals are often reimbursed at a lower rate. Medicare Advantage uses private health plans and is oftentimes reimbursed at an even lower rate.
They get what their cost to treat an average patient is. That's what they receive every time a traditional Medicare beneficiary walks in the door. When it comes to Medicare Advantage, they're not receiving their cost-based style reimbursement. And so they're consistently getting reimbursed at less than cost or significantly less than cost.
Higher costs, less reimbursements, and reason number 3, fewer workers. As we've been reporting, more and more healthcare workers are leaving the field. This is a problem that feeds itself. Workers leaving means longer hours and quicker burnouts for those left behind, a problem that intensified during the COVID pandemic. The National Center for Health Workforce Analysis found that 49% of surveyed healthcare workers felt burnt out, and 43% felt overworked. In Ohio, the problem is compounded by an aging workforce. There are efforts to recruit a younger workforce.
There's going to be a lot more collaboration happening between our hospitals and educational institutions as well, community colleges, higher education.
A more obscure reason hospitals struggle? Who owns them? Private equities, investors out to make money. Let's take a look at how one private equity group affected hospitals in our area. In 2017, Steward, aligned with Cerberus Capital Management, bought 4 local hospitals: Northside Medical Center, Trumbull Memorial, Hillside Rehabilitation, and Sharon Regional Health System. Almost immediately, Cerberus sold the real estate of the hospitals to Medical Properties Trust and began to take money out to pay shareholders. Cerberus broke from Steward 5 years ago, but there are lasting effects. The Private Equity Stakeholder Project is a nonprofit watchdog that focuses on the effects these private groups have on American life, including healthcare.
You look at some of the real estate sales, like at Stewart, where the real estate is sold from under the hospital, and then they have to make rent payments, where they didn't have to before, on top of all the debt they have to pay from the private equity deal.
Private equity groups do not buy hospitals with the hope of closing, but keeping them open is often not a top priority. And that gets complicated. A lot of companies are not interested in hospitals unless they own the real estate, making the selection of buyers limited.
The business model creates a risk of hyper focus on making a profit, and we just feel like that's against the public interest in, keeping communities healthy. If you're talking about cutting services that aren't as profitable, especially we talk about those rural hospitals, where else are they going to get services except for the hospital that's around them?
And there's nothing illegal about what these private equities are doing.
How about in Ohio? Are there any guardrails here in Ohio?
I have not seen any in Ohio, unfortunately. Does not mean that they won't become part of that trend soon. There have been states in the Midwest, such as Indiana, our neighbor, that has passed its own enhanced merger review notice law. So I'm confident that as this trend continues to go, maybe states like Ohio might participate as well.
Under the Enhanced Merger Review Notice Law, companies merging or buying healthcare facilities need to give a written notice to the Indiana Attorney General for review at least 90 days in advance. Ohio has no such similar law. In fact, a tool put together by a corporate law firm that assists in such acquisitions finds that Ohio is one of a majority of states with no effort whatsoever to gaining stricter oversight of these mergers.
There's an old saying, when one door closes, another door opens. In the Mahoning Valley, closing doors have been hospital entrances, like here at Insight Trumbull. But all across our community, new doors are in fact opening to clinics, urgent cares, and outpatient facilities, all designed to help fill a gap and keep healthcare close to home.
In many communities across the Mahoning Valley, construction crews are hard at work. New emergency departments, modern outpatient centers, state-of-the-art specialty units. Each project filling a gap left behind by closures, and each one a door of opportunity for patients.
It is not just optional anymore to work together to improve and to maintain the quality of healthcare that we have in the Valley. It's mandatory.
And that's exactly what we're seeing from some of the Valley's largest healthcare providers. Let's start with Mercy Health, whose newest investment is in Champion Township, a freestanding emergency department with a full suite of ancillary services like diagnostic imaging and lab work.
We're continuously evaluating and reevaluating what the needs are in our various communities and how we can meet those needs.
Dr. John Llewellyn, president of Mercy Health Ohio, says this site was chosen after studying where services are currently being provided and where gaps in services exist.
We saw the Trumbull County community growing in the future. We've actually seen that come to fruition now, but at the time the thought was that we're going to need to be able to expand our services. We're going to need to expand into a void that exists where services aren't being offered.
Mercy Health remains one of the biggest healthcare providers in the Valley, operating 3 hospitals and 52 practice locations across Mahoning, Trumbull, and Columbiana counties. They employ more than 390 doctors and host more than 900,000 patient visits a year.
As you look at the last year or so, we've added through Mercy Health Youngstown here at St. Elizabeth Youngstown, this unit, which is 17 beds, a new neuro-intensive care unit, which will be 16 new beds, and we've added new beds, a new unit, I should say, at St. Elizabeth Boardman and St. Joseph Warren. So really 4 new units, entire units of patients that we've added to our community just in the last 24 months.
Currently under construction, a 16-bed, state-of-the-art neuro-intensive care unit at St. E's Youngstown. Dr. James Kravick says it will be used to take care of the most complicated neurological and neurosurgical patients.
This is a very large investment of over $13 million, and we're proud to invest that back into our community with new physicians, new nurses, new technology, to be able to take care of our patients here at home. And then couple that with our new interventional radiology suite, taking care of patients as well. That's going to just be able to treat more patients in our community.
In Boardman, Southwoods Health has built a reputation on world-class surgical and specialty care. Today, their mission is bigger than any one location, and they had no plans to sit on the sidelines after the Trumbull County hospitals closed.
We took a deep dive, took a look at what was needed up there. And the first thing we did about 6 months ago was that we made sure that the physicians that were there and wanted to stay there had a chance to stay there. Proud to say that we have now over 20 docs, primary care docs, that we either employ or that are our partners.
Southwood's CEO, Ed Moransky, has long had a vision of expanding services beyond their sprawling campus on Market Street. To Moransky, having a healthcare void in our valley is simply unacceptable.
When the demise occurred, I said, we have to create up there what we have in Boardman. So there's going to be a women's breast care center there that you could go all the way from mammography to ultrasound to breast biopsy all in the same day. Women deserve that. We're going to have our own pain management clinic. We have our general surgeons in our gastro center that'll be up there. We have our orthopods and spine surgeons that are up there. So what we proved as we move urologists up there and spine surgeons, that if you have the general practitioners there, people will stay and be loyal to the community.
And Moransky says that's important to him. He believes keeping healthcare local will keep jobs and dollars in the valley.
I think we all agree that our area is better and all of our institutions are better if we could keep healthcare here. Everybody wins, Derek, if we employ local people. And if we don't realize that we need some more mental health or some rehabilitation cases like Mercy's doing up on the north side, those patients are going to find their way someplace else.
In Columbiana County, Salem Regional Medical Center is using independence as a strength, making decisions based on local needs.
Our focus is on what is best for the people who live here, and we're lucky enough to be an independent hospital, so our decisions are made by the folks who live here, work here, and our patients here. We've done a huge turnaround to value-based medicine, and so we want to show value for what we do, and hospitals having to reach outside their own walls and take care of the community as a whole.
For Anita Hexted, CEO and president of Salem Regional Medical Center, that means expanding outpatient services to improve access and affordability.
Hospitals are expensive, very expensive. And so what we're trying to do is offer imaging at lower cost than what you pay at a hospital, surgery at lower cost than what you pay at a hospital.
An example of that is the SRMC Surgery and Outpatient Pavilion at Firestone Farms, which features state-of-the-art medical imaging, a surgery center, and infusion center.
This was truly an outpatient area, so having independent diagnostic testing like medical imaging, having our physician practices here, our surgery center, we have an infusion center for non-chemo drugs that need to be infused, so really looking at everything short of having to stay overnight in a hospital.
The Cleveland Clinic may be best known worldwide for pioneering specialty care from heart surgery to neurology. But here in the Mahoning Valley, their approach starts much closer to home, primary care.
I think it was precipitated actually when Stewart and Trumbull started having their disruption, and a number of physicians, principally primary care physicians, who some of our leaders both here at Hillcrest Hospital and at the Cleveland Clinic knew and had good both personal and professional relationships with, started talking to each other, and it seemed like this was a good fit for us. It gave us the opportunity to serve patients close to Mahoning County, close to Youngstown, principally with primary care, although we're also starting to introduce a limited number of specialists in the offices. It gave us an opportunity to expand our footprint and provide access to our care.
By adding family doctors and pediatric care to communities like Austintown, Warren, Kinsman, and Niles, Cleveland Clinic is working to strengthen the patient-doctor relationship, the foundation of their growth strategy.
We recognize that the patient's most important relationship is with their primary care physician. And so for us to grow, and we do want to grow, carefully and judiciously, but we do want to grow, one of the best ways to do that is to introduce primary care physicians into the community, because there's not enough of them and the demand is remarkable.
Dr. Brian Hart, president of Cleveland Clinic's Hillcrest and Menor Hospitals, says their vision is to grow carefully and strategically, focusing on accessibility and quality over sheer size.
Our vision is quite simply to be the best place in the world in healthcare to receive care, and the best place for us on the caregiver side to provide that care. When it comes to looking around about how we grow, whether it's through new facilities or whether it's through acquisitions, I think a number of calculations come into play. One of them is where are there populations that we're not serving, and how can we improve access to those communities.
While some providers are building new hospitals or adding specialty units, QuickMed has taken a different approach, growing rapidly into a network of urgent care centers designed to take the pressure off crowded ERs.
The plan started 2017, 2018 when Northside Hospital was closing. So what we knew at the time was that Northside Hospital basically discharged about 90% of their patients. So we knew, well, this operates a giant urgent care. So that's when we knew we needed urgent cares in the community.
And so Lena Esmail did just that, opening her first QuickMed location in Liberty. Expansion soon followed. Today, QuickMed has 15 locations across the state, with the goal of incorporating more primary care into the walk-in clinic experience.
Historically, the way that urgent care is practiced is a treat and street type mentality. You're here, I'll fix your immediate problem, and then I send you back out. And what we're looking at now is really focusing more on the continuity of care with our patients so that we can convert those patients into primary care patients.
Esmail continues to take the business even further than just urgent care, expanding into women's health and mental health, filling two of the most pressing gaps in local health care.
We do have a women's health practice in our Austintown location. We've expanded all of our locations offer mental health services now. So we are slowly but surely expanding into specialty services that we deem of need. And it can vary from location to location. One of our driving factors in opening our women's health practice was when we lost two active full-time practicing OBGYNs at the time. So we absorbed their patients because the majority of their patients were Medicaid, and they would have had to wait months and months to get in to be seen just because there weren't enough clinicians that accepted Medicaid that had openings. So we said we can at least fill in the gynecology part of that gap. We're not going to deliver babies, but we can at least do the gynecology part. And that's been really impactful, and we see a lot of volume of women that are very grateful that we offer that service.
Esmail says collaboration, not competition, will be key to keeping the Valley's healthcare strong.
I think everybody has to do their part. You can't compete where you don't compare. We all do our own little niche in terms of what we do best. I mean, nobody is trying to replicate Akron Children's here in the Valley. Nobody should. I think that Mercy has a very strong and reputable methodology to the treatment of patients on every scale. Southwoods does amazing with surgeries and their surgical candidates. When you look at landscape of healthcare in the Valley, we do a really good job not stepping on each other's toes, but being able to work really well together in order to fulfill the needs of our Valley. As long as we continue to have that mentality, then we can continue to grow and flourish throughout the landscape without sacrificing care.
Different approaches, different specialties, one mission: to make sure that in a region where hospital doors have closed, care isn't shut out.
Many visions are coming to fruition here in the Mahoning Valley when it comes to health care, with a lot of those the result of the closing of this significant hospital on Youngstown's north side. But we're not blind to the fact that all needs are being addressed. Right now, in our three-county area, there are only two sites to deliver a baby: St. Elizabeth Boardman and St. Joseph Warren. And infant mortality remains a significant public health concern. That's going to do it for this edition of 101 West. Thanks for watching.